Yes.
Yes, cool. Oh, you're recording.
Yes.
Okay.
Yeah, you good?
Good.
How is it you get surprised every time I record our podcast?
I didn't see the little record button go on. It was like
I'm like, that's a natural part of...
You snuck it in there in the background. It was hidden.
It's a natural part of the
You
show.
have no... So when you introduce the show, you don't have a hard open. You roll into banter and all of a sudden it's recording. So if I seem surprised, it's because you don't have any and go.
Yeah, no.
Like you don't... You ask question, and then all of a sudden made another question. It's recording.
It's how I get going. You know, some people run like laps. I just fall into things.
You kind of trip into it, but then you say, "Why am I surprised?" It's because you've been tripping for 5 minutes, and then just somewhere along there, the recording button came on. I missed it. But hi, how are you?
And yes. So welcome to the Cheshire Cast, everybody. I am your host, Corey,
and I'm your host, Trisha.
What's with the delay every time with you? do you like? Oh wait,
I don't know if you're gonna keep talking. I don't know. This Zoom. I think this is our. I want to say our 8th episode we're recording on Zoom. It's not the same. It's not the same.
Legit miss seeing you in person once a week.
I miss Murphy.
You're a jerk.
Your dog's adorable.
Yes, you made me feel bad. Now I'm not going to be nice to you.
Don't be nice to me. It's awkward.
I just miss the company. I mean, I love the people that are in my house. Don't get me wrong.
I understand. I get it. I missed you too. I've driven by your house a few times, not in a stalker way, but in a drive-by, pickup, drop off, wave, and we've both had birthdays in quarantine.
It's true.
And we've gone YouTube in quarantine. It's not all bad. I've been spending some amazing time with my family, which has been great. I've been lucky enough to be home to help my son navigate some tech issues with distance learning. And if I was working, I don't know what I would do. And my heart goes out to all the parents who are doing, 5 different crazy things, one of which is trying to keep your kid afloat in whatever grade they're trying to maintain.
Yeah.
So I do miss you, Corey. I miss heading out. I miss, socializing, but here we are.
You had some fun over the weekend. I'm going to leave it loosely like that. If you don't want me to go into the incident, I won't. Okay. So there was a car driving around in your backyard.
Yeah, no, I don't want to put my neighbors on blast.
Okay.
I'm not that type of person. I have a neighbor who has multiple dwellings on their property, and they rent to Quinnipiac students. And it was an interesting weekend. I think there were maybe a couple graduations happening, and yeah, there was some car driving on the property and lots of police lights around midnight, and yeah, that was my weekend.
So no physical distancing going on over there?
I don't know. I don't know. From what it sounds like,
yeah. How
could there possibly be? But this party wasn't as big as the last one. The last one, they had sheets. It was like a Greek movie, like a Theta Phi or whatever. They had sheets drawn on. Party? Not on them. They had them up.
Like Animal House?
Yes, they had them up, and they had stuff
you got that reference.
I don't care. I don't miss all your references. They had Corona or Bust, and they were running around with sheets. I feel like I'm in one of those movies. I don't want to put it too much out there in case I ever want to sell my house, because it's not a good selling feature.
Yeah,
but they're over. They're not my next door neighbors. They're over.
And then the forum has been fun because everybody's up in arms about masks. And
masks,
and either wear them or don't wear them, or yeah. But what's good about all this stuff?
Times are strange.
We have 2 people on with us today that we can talk to about some of these things and why it's good, why it's bad, and so on and so forth.
Social distancing, mask wearing.
So why don't you do the introductions? I'm trying to get the shadows out of my face. It's so bad. I gotta work on lighting in here. Go ahead.
You need an under light. Okay.
Introduce our guests.
I want to introduce our guest. We have tried to have them on the show before, but they're so busy. You guys are so busy. Today we have on the Chesprocott Health District. Yes? We have on Maura Esposito, who is the Director of Health. She directs the soldiers, and we have on one of those important soldiers right now. We have on Kate Glendon. She is Chesprocott's public health specialist.
Hi, guys.
Hi.
Oh,
Thank you for having us.
Thank you for giving us the beautiful view of your backyard. It's very
That's a
calming.
green screen.
It isn't. It's what green screens are made from.
Yeah,
It's what I do to just keep my sanity going through all of this.
You
Nature.
garden. I see you got some birdhouses.
Yep. I have birdhouses and gardening and
Koi. You said something about koi.
yes, back there is a koi pond. So that is my passion, my therapy, my thing that I'm addicted to. So it gives me relief from coming home after a really long day. I can just fall into that because it has been extremely busy. I'm sure Kate can agree that I don't know where the month of April went. March was a fuzz. February 27th sticks really deeply in my head because that was the day when I had to really go around to the towns and say, guess what? Something's coming. And
Alert, alert, alert.
yes. And
Have you seen the hospital being built in China?
Yes, that was the week.
That's when I did my shopping.
Yes, and most people did. I did mine. I did a lot of mine. I will be honest with you. I don't think I hoarded toilet paper, but
no hoarding. I shopped for groceries.
I did stock up on my beans and things to get through that time. So
Absolutely. The dry goods, dry pantry stuff. We started looking for that in February, right after they started showing the 7-day hospital going up in Wuhan. We were like,
yeah, we knew something was going. We actually had been watching it back in December because we have Cheshire Academy. As the health director and health district, you really need to know who's in your community. And we work really closely with the academy, and I knew their kids, and I saw something was happening. They were having some unknown pneumonia. So back then I was communicating with Deborah Bond.
Can you clarify, was that at Cheshire Academy that was happening?
No,
she was working with them.
I was
and
working
she knew
with
that
them.
I just want to clarify. So there was nothing going on at Cheshire Academy.
No.
Just
But
okay.
we were getting prepared.
so
knowing that
the residential
the
living.
Chinese.
The residential living alerted you to this might be a place that this virus, if it comes here, could proliferate. So let's get a handle.
Right.
Smart.
It was near Chinese New Year,
Yes.
and we knew they were going to be traveling. And there was travel.
Huge holiday. Huge holiday.
Travel restrictions. So it feels like a really long time ago.
Make sure that anyone that was going to go back and see their family might know they may not be able to come back to campus. But they have wonderful staff over at Cheshire Academy with great protocols and a great headmaster and nurse. And so everyone, worked together to make sure that there was, no visitation after the new year and so forth. So they really were on top of it. And we had been on calls with the Centers of Disease Control in January. So we were gearing up and kind of just sitting and waiting for it to come.
Watching it very closely.
Yes.
Watching all the news breaking and whatever was being released. Because I remember it was when it first all was happening, I guess, January. There were blurbs here and there. This is happening, and they're building this. And so if you're in your line of work, you're paying attention to that stuff. You see that as red flags.
On the front page of the paper, when Kobe Bryant died in a helicopter crash, there was a little article.
Yes, that's my husband feeding the fish.
Okay, that's fine.
Hi, husband feeding the fish.
There was an article about the coronavirus outbreak on the front page of the paper, and that happened in January, I think.
Yeah,
I don't remember. It seems like a lifetime ago.
It does, but it wasn't really that long ago. If we think about it, it's just yes, it was. There were just so much different things going on.
Well, it did start when I was a much younger man, though.
Yes,
he's aged a year.
Wow.
Me too. Me too.
The virus can do some crazy things.
Yep.
We won't talk about that.
No, I
This hair
celebrated.
salon thing is driving me crazy.
I celebrated a birthday. 9 days ago, right? Like a week ago. So yeah,
Mine was March 18th, and I went into quarantine on the 13th. So
2 months ago for you.
yeah,
Wow.
my son's is next week. Your son's is tomorrow. It's a whole generation of birthdays that are going to have to be
Kate, what do you
celebrated
do?
next year.
Done.
What do you
We
do to
celebrated.
unwind, Kate?
What?
What do you do to unwind? We touched on what Maura does. What's your hobby?
Oh, well, I attempt to garden. I throw things in the ground and just, see what happens. So I'm usually pretty lucky with that. I do a lot of physical activity, whether it be walking, yoga, working out, kind of stuff like that, just to unwind. But yeah, we've just been kind of pushing through, working every day since February, and just trying to keep our community healthy.
Are you guys going into the office every day, or do you guys work from home? How do you guys set up?
We had originally been set up to work remotely. Because we're such a tight team, and my office is very small. There's only 8 staff, very small department. And we have our own offices. We all have been, it's almost like a pact. You know who everyone is with. We know that no one is going to put anybody at risk. So we have been working in the office, and it helps because there's so many dynamic questions going on. And if you try to go on the CDC website, it will take you days to dig through all that information. So Kate really understands. She talks to all the cases. So she knows those people and where they're coming from and their exposure. And Susan has
A
been
tracing
working,
kind of thing.
yes, she has been doing very preliminary contact tracing. While Susan has a very strong environmental health. So when we were having early outbreaks in our nursing homes and in our group homes, her background is very strong in attacking that outbreak. So it was a team effort. Everybody was bringing something in.
Mm-hmm.
And I myself have a background as a sanitarian. All 3 of us have masters in public health. So we all kind of know what our job is. I have a lot more public health emergency preparedness than the other 2 girls because I've been doing this longer. So I understand the path and the navigation through this. But they've been there.
Is that a governmental navigation, or is that just supply chain and distribution
Everything.
and education and retraining and
Everything. Yes.
You live in Cheshire?
Doesn't end.
We've been getting deliveries every Tuesday. Chesprocott is the lead health department in it's called Region 2. It covers from Milford all the way to Old Saybrook, all the way up to Cheshire. So it's like greater New Haven area. So every Tuesday we have to go down with the National Guard and pick up our deliveries. So today was a delivery day. And then
Delivery of what? PPE or
PPE.
just okay.
Different
Personal
stuff.
protective equipment. Sorry.
Yes. Our masks, be it sometimes they're surgical masks, sometimes they're K95s. We haven't had any N95s in a while.
Where are they coming from?
China and Taiwan.
Taiwan, yeah.
So the K95 masks, there was just a big expose on some of them not being effective, but I guess you guys just keep on top of the deliveries and what's happening with that.
Yeah. The China see the K95s as USA N95s. N95s in the USA have been tested by NIOSH, the National Institute of Occupational, I don't know. I can't remember all those acronyms. But they've been tested and they don't meet the US standards. So they are just being used as surgical masks.
Okay.
So
Disposable, one-time use, prophylactic. Okay.
Yes.
Okay.
National Institute for Occupational Safety and Health.
Thank you.
You know what?
I knew
Being
there
a
was a health in
firefighter,
there somewhere.
I should have known that too, because I have.
Okay.
There's so many.
You
There's
know,
so many.
so don't feel bad. I was like,
I'm like, yes.
You know, we kind of
all
jumped
good.
into this
know-
really. We started at like D. Tell our listeners, including myself, because I'm new to the area, what does Chesprocott do outside prior to global pandemic? What was your main function and your geographical area? And
Yeah, I mean,
explain
did you even work
Chesprocott.
before this pandemic?
Well,
No,
I
I
think you
can't
were so busy.
remember. I can't remember what I have to do every day.
Slackers.
So Chesprocott is a regional health district. So what that means is back in the early 70s, the towns couldn't afford a full-time health director. So they joined together, Cheshire, Prospect, and Woolcott. And this way, they all funnel their funds and they can have full-time staff cover them. We have 3 divisions in Chesprocott. We have a very strong environmental health, which Susan is the chair. Now, they do our restaurant inspections. They do our daycare inspections, our septic installations, any additions or sheds, decks. That's called a B100 review. They do public pools and
So
nuisance.
you guys are responsible for the letters outside of a restaurant, like A.
Yeah, well, yes, we don't do that in our district, but yes.
Okay.
Well, I mean, I found out
Okay.
recently by joining the board of directors for the Ball and Socket Arts that there.
Oh, you know us well.
Yeah. So I and I didn't. I mean, I kind of knew. Kate, you okay?
Yeah, I'm
Okay.
here.
I wasn't-
Excited.
I thought you fell over the way it looked on my screen.
Her phone's like, I'm tired.
I'm glad it was your phone.
It's been a long Tuesday.
It's been a long day.
I mean, I knew
Today's Tuesday? Okay.
I knew Chesprocott had something to do with, buildings and, but I just didn't realize until I started to read through some of the documentation we have for that property, how extensive it really is.
Yes,
So if
because
there's
a lot
ground lead or
groundwater.
something, you guys are okay.
Yeah.
Yeah, we protect the environment. So your drinking water, there's no wells over there, but in that particular facility and many others, there's lead paint. We do a lot of lead paint. So that's Susan does some because she'll go in and test. And Kate does a lot of the public health because Kate is our lead for our what's called our community health division. So that community health division looks at all our communicable diseases. There's over 200 diseases that are reportable. So anybody in our community that gets a communicable disease, which COVID is one of them, we get the lab report. And on certain diseases, we have to do follow-up, and that's where Kate gets in. Susan gets in when there's like a foodborne disease in a food establishment because they're more comfortable. So
like salmonella.
I want to I want to interrupt for just a second because you said you guys get lab reports on I'm gonna trip over that word.
Communicable.
Thank you, Tricia. That's why you're here. So when you get a lab report, that's anonymous, right? You don't know who that report is attached to, correct?
I know it. The director of health, it is my responsibility to keep the community safe. And yes, I do know the demographics and the name, and I know that information.
Okay.
So no HIPAA there. That's not a violation.
No,
That's for recordable
if you look
purposes.
in the statutes, the health director and my agents, who are Kate and Susan, were exempt from a lot of that.
Okay.
Yep.
And
that,
purely for the protection of the community.
right.
Yes.
And for our listeners who are concerned, that is very clearly defined in the HIPAA policies and the HIPAA laws. I also work in healthcare. I'm fairly well versed in HIPAA compliancy and so forth. I just wanted to clarify that because somebody's going to hear that and they're going to have a question.
And think it's an executive order and get really mad.
It's
no,
not.
Everything is confidential and kept in house and followed up if need be with contact tracing, or if we need to follow up with individuals that might have been exposed or for further education. But it's really just to find out more about how the person came in contact with that illness, the virus, what we can do to help them, and just report that data to the Department of Public Health to see if they need to follow up with further information.
And
So
that information is transmitted via encrypted channels, and it's locked behind closed doors and all that stuff.
We
Okay,
have,
Privacy
so with
screens and blah blah blah.
yep, and we have a system that connects us to the Department of Public Health. It's called the Connecticut
Electronic
disease surveillance system.
Okay.
And so that's
We'll get through it. We'll get through all of this. I promise.
We'll generate all our diseases or outbreaks. So for right now, with this system being down today or the past 2 days almost, we don't have the correct numbers for our cases or anything like that.
Thanks for clarifying that.
With regards to contact tracing, pop culture wise, just something that everybody's living through right now.
Wait, you're going to make a pop culture reference?
I'm interested here.
Yeah, I'm interested to hear too.
Regardless of what side of the conspiracy theory spectrum you fall on, people are worried about contact tracing. Specifically, it's coming up a lot right now because of ways in which other countries handled identifying, tracing, and eliminating the virus in their environments. But they have they're not democratic. They have different political systems. Mm-hmm. So the contact tracing, I need you to explain to me and whoever else cares, why is it so important? How it's not a violation of personal freedoms, and why do you do it? Why are we being asked to give up some of our personal information?
Because it stops the spread of the disease. So you are shedding the virus, and you are exposing other people 2 to 3 days before your symptoms start with COVID. So all we're really doing is we're actually protecting your contacts by calling them and letting them know, you might have had exposure. You need to we recommend you stay home for 14 days. You monitor your health. If you don't feel well, you call your doctor. Or, now it's so great, you don't need a doctor's referral to get tested. But the more people that we can contact and let them know that you've been exposed and stay home, that's one less person that's spreading the disease. So for every positive case, right now they're saying they could have up to 12 contacts that they've been exposed to.
And those 12 contacts could be positive within a couple of days.
But even with the positive numbers that are being reported, I mean, I know I have a friend who was sick and he was in the hospital and he was counted as a COVID positive, but not his wife and not his 2 children. And they all got sick. They all clearly were sick. So,
still sick.
I think the counts are probably a lot higher using that example.
The counts are, there's so many arguments that can be made in any direction for the counts, whether it be the R naught, whether it be the mortality rate, whether it be the spread rate, the numbers. But I will end that sentence with testing is really going up. And that's a huge benefit for us. Mm-hmm. It was really slow in the beginning, not just for Connecticut, but for the entire country. And I'm seeing numbers tested in Connecticut is really steadily climbing. And I'm really happy about that.
Yeah. We didn't have the equipment.
Absolutely.
Test. And that was the problem. So that was, those people that were the worst case was left for them. But we were trying to say, and Kate did a really great job of really telling everyone that, if you are having the signs, you probably assume you have it. So now with this,
act as though you do.
Yes. And so now with these drive-throughs, which is wonderful for us because it's another tool we can use to open things. Say you want to visit your grandma. Okay, guess what? You can go through the testing, and in 15 minutes, you'll get an answer. Now, I don't want to get on the false negative rates, but it at least gives you something to know. It's better than nothing to know whether or not, because the one thing you don't want to do is infect someone else, because
it's a dim light, but at least you're not functioning in the dark. It's dim.
We've come so far, and I think that's what we need to remember. we were at, stay home, no idea when we were going to be getting out of that, to have not having tests, not having PPE, to the complete opposite. Now you don't need a recommendation to get tested. Now the state is starting to slowly reopen. So we have to think of, there is a light, there is hope, and we're working towards that. And unfortunately, when we had to call all of our cases, we let them know that their whole household should probably stay home with them for 14 days. And then if another member got sick, restart those 14 days. So we were right there. We feel for everyone who couldn't go to work or was stuck for.
You guys were helping with bringing them stuff too, right? I know you guys said, everybody, we're going to organize people getting what they need. Nobody's going to starve in quarantine.
Well,
we worked with Human and Health Services in our towns, the United Way to get people food cards, anything that we could do. We even collected games for our long-term care facilities so that they could have something to do to lift up their spirits. And we couldn't have done that without our community who helped do that. The amount of PPE that we got donated, cloth masks that people dropped off, hundreds of them. And
it involves everybody in feeling like they're doing good. Helping helps you. So involving people really, it encourages that community.
Can we touch on that a little bit? The community aspect of helping. Now, as an admin of the Cheshire Forum and being as connected as I am with Cheshire's local government and so on, very early on, everybody wanted to help. Oh, I'll go get groceries. Oh, I'll go do this. I'll run errands. I'll do that. And we put the kibosh on those notices on the forum because not just me.
You were worried.
But
you don't know who has it.
I didn't know what to do. And I didn't. So I get on the phone with Michelle. I say, hey, Michelle, what am I supposed to do here? And that's when all the communication came out. Like, if you want to help, here's the number. You guys, I know we're in on that, correspondence, and we started to push everybody to contact Human Services or you guys on the proper way to handle it. And it wasn't that we were trying to keep people from going anywhere.
No,
it was a health safety thing. And, if you're going to do it, let's do it responsibly together so we're not getting people sick. That's correct?
We need people to stay home. Yes.
That was absolutely, and that was very challenging because we knew everyone wanted to help, but it was like, no, you're helping by staying home.
Right.
And that was really hard. But I will tell you that the whole sewing thing really helped, and the kids got involved using their 3D printers, making face masks that were needed.
But then Facebook screwed up the algorithm, and it
you guys got in trouble.
We kept getting flagged on the forum for false we were. So Facebook was taking action on posts where people were trying to make masks. So I
remember that.
So we had to stop people from doing it. Otherwise, Facebook was going to delete the group.
Because people were using masks as a way to scam people.
And then
they had to cut down.
Come with that.
And it got right. And people got so mad. I'm like, guys,
because you are all about censoring people's First Amendment rights, Corey. Well, you don't believe in the Constitution.
I don't believe in the Constitution or free speech. Me of all people.
And the Cheshire Community Forum is a fascist, socialist environment. I don't know how it's fascist and socialist at the same time, but you've managed to do it.
We've managed to, and that not that.
Congratulations!
Right? I'm brilliant.
He's ruined it for everyone.
This brings us to a touchy subject of this whole COVID-19. Okay, so you have the us versus them going on, it's brutal. I can't deal with it anymore. You've got she's not wearing a mask and he should be wearing a mask, and people.
And I'm not wearing a mask because
I'm not wearing a mask because it's my right.
I know.
Yes. Yeah.
What? Officially,
it's not getting any better.
No. What's the health benefit to wearing a mask? I mean, what?
Wait,
I know it seems like such a silly.
This virus is airborne, correct? It can transmit through aerosols.
Yes.
That's a fact at this point.
So,
Yeah.
so what is,
Okay.
what is the
Yes.
health
They're
benefit to
still
wearing
trying
a
to do
mask?
a lot more other research on it. Kate, do you want to explain the mask? Because you usually do a really
The
great
mask
job.
I know it seems like,
yourself.
right, but I
Yeah.
know it seems like a silly question, and I'm asking for the person who doesn't get it. So,
Do you ever spit when you talk, Corey?
well, that,
He
yes,
does all the
constantly.
time.
So if sometimes that could have a virus in it. So
Mhm.
if you're wearing a mask or you're sneezing or whatever, your mask is keeping your germs to yourself. It's not spreading it. And the same thing, you're breathing in your own breath, we hope. So if you're wearing it correctly, so it's it's keeping those droplets to yourself. So you're protecting your others by wearing a mask. So we kind of say it's like a sign of respect because you're doing your part to slow down and prevent the COVID transmission by wearing a mask. And you need to do it when you go into public places. If you cannot maintain 6 feet distance outside, you need to wear it. And sometimes you need to wear it because you're around people who are autoimmune compromised or over the age of 65.
But what if I'm not sick?
Yeah. What
Or
if I'm
if
not
I have no
sick, Kate?
What if I'm not sick?
But there's the asymptomatic people.
Mhm.
The
That
asymptomatic people.
You don't know that you are sick.
You guys did pick up on our sarcasm, right?
Spreading at
Yeah.
that.
Okay. Just
Yeah,
want to
I
make
hope so.
sure.
You got it.
What if
Masks
what if
are
I
cool. People can decorate them. They have some beautiful masks. Like, it's trendy. It's 2020. Wear your mask. It's the right thing to do.
Trisha,
What
should I
if I
show
put
them
it
my
on and
mask decoration?
what if I no?
Okay.
What if I put it on and I get a little claustrophobic?
Maybe you need a different mask. Maybe you need
One more that's more breathable.
Yep, there's those options if you can find different types of materials that work best. Maybe you need to get fitted for one.
What if I'm going on a public concourse where it's outdoors and there's plenty of free space? I come across a lot of people walking, the same way I'm going, but then there's bike riders and joggers that will cross paths with me. Is that a good place to wear a mask or no, because I'm outside?
We encourage you to wear a mask.
If you leave your home.
There have been studies about how this virus has to have a certain contact time and a certain virus load. Okay. I don't want to get into all the complications because
it's changing.
It is. And we really still are learning so much about this. That's why it's novel. Yes. We just don't know. In 2 years, we'll know more. Okay. So for right now, we know there are people that medically cannot wear a mask. We know that kids don't hold the masks on. So if there's a way that you can help others, please help others by putting your mask on. The surgical masks make it a little bit harder to breathe. You can get a cotton mask. They've got several different designs, and we've seen some beautiful ones. Some come up to the nose, some have the metal wire in them, some are just flat straight across, come up.
They have an interesting design, right, Trisha?
They're all they're all stopping the drop.
Exactly.
To some percentage.
Yes.
Right.
Different masks have different porousness or whatever, but to some degree they're helping.
Right. Just like washing your hands prevents germs, wearing a mask prevents the spread of COVID-19.
So you're not protecting yourself from breathing in other germs with the mask. Your main priority is that you're not projecting out your own germs.
You're protecting other people. You're not coughing on Cheerios that I'm going to buy 5 seconds after you walked out.
It's proper etiquette, respiratory etiquette.
See how simple it is to understand this? Hold on, let's explain it again.
When people's rights feel bruised, you will be amazed at the lengths they go to.
We need to explain this real quick. Okay? Because I don't think people are getting it. If you have a mask over your face and you cough, you're going to cough into that mask. And nothing's going to catch. It's going to catch it like a catcher on a baseball team catching the ball. It goes into the glove.
Some of it.
Right? If you then cough in the candy aisle at Stop and Shop. You're not coughing on anything. You're coughing into your mask, the one that's on your face.
Mhm.
If you don't have that mask and you're asymptomatic or even sick and you cough on the candy that I'm picking up, it
Mhm.
gets on there, it gets on my hands, and then I go, oh, my eye itches, or I pick my nose or whatever. Now I'm sick.
Or
And
you
then I
touch
come
your
home.
doorknob, or you touch your key, or you hug your wife, or you
Well, how
pick
many
something
other
on your
things in the
kid's face.
supermarket am I touching? Between
That's
the
why
candy
you
aisle and
wash
the
your
end,
A
hands.
lot.
right?
Yeah.
Mhm.
Okay, so everybody think they got it? Not, I know you guys get it. Everybody else who can't respond to me right now because you're just listening to the sound of my voice or watching us
My
on YouTube.
body, my choice.
You
I'm
get
not
it
wearing
now?
a mask. Sorry. My body, my choice. Don't tread on me, Corey.
Oh man,
We have a lot of that, and it's very challenging, especially working in the field of prevention.
People are getting hurt. People are
Yeah,
getting shot because they're asking customers to put on a
they're
mask.
getting very irate, and it's just like, just take a deep breath and just be kind. I mean, I can't say it enough. Just be kind. This is very difficult. All of us are mentally challenged with this. Staying home and isolation, we are social beings. This is not good mental health.
right?
You're doing something completely not normal for us. And so we're all stressed at some level, but you have to just take a deep breath and think about why. And, for me and Kate, talking to those families that have had people to pass away, 35 years old, and have been on a respirator for weeks, and their
Unable to
families
see
can't
them.
see them, it is really very hard for us to listen to these people. And they reach out to us. When you do these phone calls, and Kate can attest to this, we're on the phone with them for an hour. These people need to talk. They want to tell their story. They feel like, they've been isolated, alone, and we're the only ones coming in to offer them, what can we do for you? What do you need? Do you need food? We'll get you that. We had one lady, she was like, it was so bad in her house, we'll bring you Lysol wipes, at the
Mhm.
time when we had them.
Right.
We were doing whatever we could with what we had. I wiped out all of anything I had because we do emergency preparedness
Mhm.
is another one of my divisions, which we didn't talk about, but so I do drills, and I had cases and cases of sanitizer. I just gave it all away. I had masks. I gave it all away to the EMS at the beginning because they had nothing.
Well, we've done drills with you on the Cheshire Fire Department.
Yes, you have.
Yeah.
Yes. And that probably will be happening in the fall when we do a vaccination, if we vaccine.
I have
Or
no,
the-
I have no
the
issue with
second
learning
peak.
how to. I have no issue with learning the proper way to help the people in my community.
Yeah.
I mean, that's why I volunteer, not to, but I mean,
Yeah, and
whatever.
Chesprocott does have another volunteer. We have public health volunteers
Mhm.
that do the drills with us. You hear the governor talking about the CT responds. All those people have signed up new. So we've got probably 100 people that we will be talking to after this meeting and training them to become public health volunteers, because my department is 8 people and I do 3 towns, 56,000 people. There's not enough of me and Kate's to go around. I mean, if I could duplicate Kate, I would have millions of her. I mean, really.
Let's think
We
on that
didn't-
for a second. Hold on.
Would they all be working under one salary? Because that would really work out.
Yeah,
very
right?
well.
Like-
I would love that.
Let's do that right now.
I'm sure the board members would love that too.
Does she
What?
watch kids?
Right? Well, one of our clones might.
Right. What I'm
Um,
saying.
Maura, what do you, or Maura or Kate, either one. The conspiracy theorists say the hospitals are empty. This is a made-up disease. People aren't really dying.
Can I tell you that so every week it's like the new item of what we're trying to find. Last week was body bags. Never in my career did I ever think I would be calling and begging people for body bags. Because we
amount of-
didn't have them. And people are dying.
the
It's
amount
not
of people
unique
I've
to us
talked
either.
to, over 200 people in tears on the phone because they're so sick. They can't take care of their family. Their father may now have an organ failing, all because of that. And they're under 65. Or people who can't go to work because they lost their job for COVID or they were laid off and they're sick. It is something that happens every day. Every other day that we have a death almost in the community. It's still prevalent. I think that people forget as the state reopens and the warm weather comes that we kind of want to just forget about it and pretend we can just go forward. We
COVID
can go
fatigue.
forward.
It's an actual thing.
Yep.
The COVID
Yeah,
fatigue.
we're
People are
tired.
actually.
But guys,
But
it
this is
only
the time to
affects the elderly and the immunocompromised, right?
Not in our
That's
district,
what
not
they're
in our
saying.
state,
I'm
not
being
in our
sarcastic
United
still.
States.
Our first death was 35 years old.
Mm-hmm.
We have
And now he
babies,
was a man that went down to a hot spot.
Mm-hmm.
And a hot spot was identified in New Rochelle, New York. And guess what? He got exposed. He passed away. He brought it back. He brought it back. He passed away, but his wife got very ill too.
Mm-hmm.
And his brother is being a real champion up in Wolcott about what horror the family went through. And I think that Kate and I know that once it gets in the family, it goes wildfire.
Yeah.
Everybody gets it.
It's so transmutable.
You can test positive up to 6 weeks, if not up to 80 days in some studies.
Well, the family I know, they've been sick for weeks.
Mm-hmm.
I know multiple families like that. One of my friends is on day 57.
And
Yeah.
and
That's
We're getting a lot of requests to do recovery rates. So on May 1st, I had Kate call up all the original cases. And I had to go back and say, after about an hour of doing that, we're not doing this anymore. This is a waste of our time.
We're
Because
not ready for that
still
yet.
sick. Everyone is still showing.
Compromised.
so listen, you guys, I don't think our community understands what you guys have to contend with on a day-to-day basis.
Mhm.
As far as I can tell and hear, you guys are first responders too. I think you're doing what you have to do to help our community.
Thank you.
I want to ask you, well, first I want to thank you for that.
No,
But I want to ask you, how are you guys doing mentally? Are you okay? Are you getting the help you need? Are you doing what you have to do? Because we can't all be superheroes.
Nope.
And we have to
And you
do
can't be, the sustainability of it, you have to take care of yourselves too.
Every Friday, I treat the staff to a really nice Byron Rondo lunch because they all like salads. So trying to give the girls morale is the biggest thing as the boss,
Mhm.
because I know I'm burnt. I know they're burnt. We have been going nonstop since February. We have worked overtime almost every single night. We work every Saturday. We work every Sunday. We have not had a break. If there's someone out there that wants to give us a house in Aruba for a week, I will find a way to get
You don't want to fly yet. You don't want to
You
fly
can't
yet.
drive to Aruba, you know.
I know, but I
Not yet.
Newport,
I know.
Rhode Island, my favorite spot.
Where?
we all love the beach and we all know what each other like. And I think it has really brought my staff together. My biggest thing, and I'm just going to touch upon the first responders, is that I don't think really, honestly, the town leaders probably know really what health districts really do, because really the septics are still going in. People are still doing their additions. We are still operating with this thrown on top of it. So I still have to get out my financial reports. I still have to, this is just another layer. Now, if I was in a big health department, I could spread this out, but there's only so many of us that we
Sure.
can do this. And that's really challenging. And I think the next big challenge that we got hit with last night is the enforcement of these rules now. They really threw it at public health, that we are now going to be enforcing all these rules in our regulated.
With eight staff members?
Yes.
I
And that's
heard
what
New
I
York
tried
is
to say
hiring
is
like
that
17,000 tracers. You guys need something like that.
well, that's it. I've said that. I'm like, I have to start contact tracing deeper.
How?
I've got to be out monitoring these now social distance with these outside dinings. I've still got to keep working. I've got to still keep delivering the PPE to everybody. There's at some point I turn around and we all just kind of look at each other because
there's no more time in the day. There's no more days in the week. I don't understand
You
how
just
they
have to
expect you
make
do
more
that job.
time in the day, Maura.
When are you cloning this one?
Jeez.
When is she getting
and
cloned?
she's really good. I have to say, my whole staff is the best staff,
Even
and I'm
the best.
really amazed by them. But you're absolutely right. I mean, there are limits, and I keep pushing back. I'm like, no,
it needs to be done though.
Yes, it does, and it's
Wow.
been challenging to see where we go. I mean, we're
making this up as we go along. Absolutely, this is being made up as we go along because it's unprecedented.
When was the last time you guys were this busy?
We are busy.
I don't know.
But like this.
Well, when Ebola came,
Okay.
that was a really crazy.
Were there 3,000 cases in Connecticut?
No, but it was scary. It was very scary. We did have one visitor. That was it. But that was about, my office is very busy. I mean,
my brain can't wrap around adding the maintenance of this and the progression of it because we are not anywhere near even mid-cycle of this pandemic. I mean, do you see a second wave coming? I mean, there's so many more ifs. Well, and you're functioning on a 8-person staff for 3 counties.
Flu season coming up, so we'll see how that takes.
And summer. And
we still have to monitor public pools and see what's going on with recreations and camps, and then school starting. Meanwhile, continuing on with all the day-to-day things that keep us afloat. And we have a Healthy Communities Coalition that is still offering mental health mindfulness and stretching workshops. We're now working with the Library and Human Services to offer a Zoom group for parents to coping with it. We had a 20-person Prevent Diabetes group, that was running up until COVID, and we still try to send out some information to them, but we still have to keep our community healthy in that aspect as well. And prepare.
Addiction doesn't end. Teen pregnancy doesn't end. Diabetes doesn't end. Mental health issues
about what happened to opioid. And we've got addiction season, and we've got tick coming, and everything that
none of that ended.
Well, that was one of the arguments on one of the forums today. Somebody said, well, the opioid crisis and the drug addiction crisis and blah, blah, blah. And I said, last time I went to the supermarket, I didn't come home a drug addict.
No.
Like you don't go to the supermarket and become an alcoholic
and catch addiction, because but you can catch death. It's true.
No, it's a disease. It's an illness. It's a long time. We are offering a Zoom Narcan and suicide prevention Zoom in June because we don't want to stop giving the community things like this that's going to benefit them. We need to focus on the things like that, promoting physical activity and mental health and healthy eating and test your well. And Radon will be here in January. So we still have to, do what we do for our community. and prevent spread of COVID.
So Maura, you're
Yeah.
getting you do the Viron dinner, you said, on Fridays. Now you guys
Lunch.
You guys are doing that in office. So on one Friday, can I maybe bring like a comedian or magician to like cheer you guys up for a half hour or something?
You have to
He means
stay
himself.
outside.
He just wants salad.
No, I have a guy, or somebody to play some music or something. They'll all put masks on.
Yeah.
Something for morale.
Except for one of
When
his
they get
things
something,
is
it's very nice. I mean, we get excited when people bring us masks. I mean, we get excited when we hear there's a donation outside. That just like raises everybody. And then somebody anonymously donated us all Panera cards. It was the little things.
Panera.
That was the littlest thing, but it was the nicest thing. And everybody was so appreciative of it because we are working really hard. And when public health works hard, you don't recognize it because we're keeping you safe. It's when things go awire, and we're trying our best.
Are you sure you're not part of the government conspiracy to control us all and strip us of our rights?
We're
Just
too
yours,
busy for
Corey.
that. We're too busy.
Too busy.
Who can worry about the Constitution?
I am way
That's
too
not
busy
going
to
to get
deal
me a
with
lot
that.
of links on Facebook.
What role do you guys play in opening up?
Huge.
Is it
Huge.
recommendation? Is it just stats? What
It
role do you
is
play?
every time the governor puts out a letter, it's consult your local health department.
Oh boy.
So it's graduations. It's every single school. And
Everything
remember,
that's going to get you in
I
trouble.
have 3 of them. Plus, middle school.
Can't make everyone happy.
If the camps, see health department.
Daycare.
Summer school, see health department. So I've got Cheshire Academy. Let's think about how are we going to do August? I'm like, I can't
Fall.
think beyond this week.
I mean, we're still managing the long-term care facilities as well, too. So on top of that is his own job.
We have a senior assisted living place coming on the show soon, and I have so many questions.
Who don't we have coming on the show, Trisha?
I know,
You guys
it's
are very
busy.
popular. Busy.
Thank you. I really appreciate you guys coming on.
Wait, is that a real compliment?
Yeah.
Who, me?
Great.
From
You guys
Kate.
are awesome. Yeah.
I can't tell. She's got a wicked sense of sarcasm. I can't tell
She
now.
is dry. She's dry.
Yeah, she's just like me, and I'm like, wait a minute.
I've been waiting to be on this forever.
Yes.
You just found out this afternoon you were being on the show. Stop it.
Kate is good. We can
She's
get
like,
on
wait, we're
any
on video?
kind of
Hold
social
on.
media. Kate is very happy about that.
I was like, are we on video? I'll be right back.
I'll be right back. You hear?
Yeah, I got to be honest with you. Your hair looks really nice.
It's just lucky today.
That's what I say every time. Just it behaves for the camera.
Yeah, I mean, I got a haircut the other day. My wife did it.
Okay.
Oh, that's Corey. Did you see? There's a lot of critiquing Lamont recently about his haircut and how can he keep salons closed because his hair's so nice. And I'm sitting there and I'm like, I've been cutting my husband's hair for 20 years. Like his wife is probably sitting there like, stay still, stop moving. And he's probably got like in the back, like a bald head.
Yeah.
Why?
It took my wife 2 hours
hair?
to cut my hair. It takes my guy 15 minutes.
Why do you have, whatever.
But it's 2 hours I get to spend with my wife.
As well.
Yeah. Women are
if
very
you tipped better.
precise. You're good.
Yeah.
I get so nervous when I do it, but I've been doing it for so long. As long as he's okay with like the TP and bald, we're good.
So Corey, tell us what the Cheshire Community Forum wants to hear from Chesprocott.
Today's salons.
It depends.
Today's salons.
Oh boy,
to be honest, it's all valid. They're all valid.
So I will tell you that there's a sizable portion of our community, the majority of our community, not a sizable portion, the majority, that is really, really supportive and really, really nice and really, really understanding and gets it. They get it. They
Is
really
that the
do.
silent majority?
Well, unfortunately, I think a lot of them do remain silent because they're afraid of the one or two people, referencing the forum, that is, that will be loudmouth.
Mhm.
You know,
It's uncomfortable.
it does. Yes, it frustrates
Can
me
get-
to no end.
I post everything. I post a lot of Kate's Chesprocott stuff on
Yeah.
my own page, and I have a lot of followers, and they all know that it's only nice here.
Yeah,
Saying
I
how hard
get it.
we're all working, and I only
They
want
don't.
nice
They don't
things.
call you a fascist if you erase
No.
one of their posts. if
Oh,
they
I get.
curse.
Well, I don't do that.
Yeah,
I defriend them.
I mean,
Yeah.
Maura,
it
isn't
there.
that a wonderful feature?
if only
Life-saving.
people understood that, and I know Trisha has seen me do it and could vouch for it. I do the best I can to have everybody's best interest in mind. And I think on both sides of the coin. I look at both sides and I try to
Someone's
find,
best interest might just be venting.
you know,
That might be in their best interest.
I
to get it out.
understand. I get that people are scared and frustrated, and that's why they're like, it's the government and this. Yes, when you're scared, you have to
we lost
focus your
control.
energy on something else to get out of your own head. And I get that 90% of those people, that's what they're doing. They're venting to make themselves feel better, so they stop worrying about this thing that
Gives them
might
something
get
more
them.
tangible to be mad at. You can't be mad at something
That's why you have
ethereal.
the protesters in Michigan Michigan and everywhere else.
The 12 at the city hall yesterday.
Because
I saw that.
they need something to be
One
mad
from
at.
Middletown.
Yeah.
Right. And sometimes releasing on Facebook is the only way that people can share their emotions or have feedback or have any interaction, especially now if we're, people are relying on social media to be social.
And that's 100% correct. And I've had
And
this
there's
conversation
validity
with
in
the other
every point.
admins, and it's like, these are people who are usually at work all day. They're doing whatever they do, and now they're stuck at home and they're seething because they don't know how to handle it. They're and all they have around them are possibly like-minded people that are just saying, "Yes, you're right, honey. Yes, you're right. It's this guy. It's that." Luckily, my wife and I don't see eye to eye on many things. So, I'll say something. She'll go, "You're crazy," or vice versa, which is, I think, fine. And
Perspective, it's good. Perspective is good.
Yeah.
But something, I mean, I can go on
why
for
we
another
need
hour
to-
about it.
Yeah.
This is your therapy, Corey.
We're having a lot of,
it is.
this is going to be challenging, especially social services, because
It's only the beginning.
I know, and it's not going away. And so that's when we need to know who our behavioral health specialists are and work with them. And, just like you said, first responders, you got to take care of yourself too. You take care of yourself first. And
if I don't take care of myself, I can't show up at 2:00 in the morning and cut you out of a car if you're in an accident, or run into your house if, God forbid, it's on fire. I mean, yes, it's Cheshire. We don't have that many situations happen, but
Knock
when
on
they
wood.
do, they happen, and we need to be in mental and physical health. Same with you guys.
Yeah. Kate's a great
Parents,
person
too.
because Kate sits there and she'll go out, and all of a sudden it's out for a walk around the office, collect herself. We've done some walking meetings because we need to get
Nervous
out.
energy. Yeah.
And so we're practicing what we're preaching.
Yeah.
Most people, and people shouldn't feel that they're confined. I mean, that's why I come outside. That's my place. And so I think everybody needs to find their place in this.
And you've created order behind you. I see it. Even though it's nature and you've got everything's organized and it's tidy and it's well taken care of, I can see that's your zen right there. And you need that. And everybody needs to find it. It doesn't have to be gardening. It could be, honestly, it could be reading Facebook comments. Some people really are cathartic with it. Yes.
And
multiple things.
I play video games.
And Kate is at home doing the Zen downward, upward, backward cow moon dog pose.
Sometimes.
It's like, how's that one go? It's like,
she's probably
just
sleeping
like
when
that.
she's
You
home
did it
right now.
perfectly.
like that.
Right.
She's either eating or
Don't get me
sleeping.
wrong. I watch a lot of Netflix too.
Oh yeah, what's your favorite show right now?
What you got going on?
I got to start Dead to Me.
Have you watched Dead to Me at all?
Yes, I got to watch the second season. I've been really into Ozark. I just started that.
Okay.
So that gives me
Is that
weird
the one with
dreams.
Jason Bateman?
Yeah.
Okay.
So, and I'm in a book club. I tend to forget to read the book. So I've been really trying this month.
You're just a member of
Sitting
the
and reading,
club so you
wow.
can drink wine. I get it. I know.
My wine
It's
club
okay.
has a reading problem. That's funny.
That's all right. So,
And laugh. Find time to laugh. That's a huge relief. Laughing, even though everything around you is chaotic and crazy.
Yes.
Laugh at Corey if you have to.
I mean, that's why I'm
Just
here.
think about him and giggle.
Look at
It
this.
helps a little.
I was made to be laughed at. Look at this.
In your Max Headroom
You're
corner.
born that way.
You gotta laugh.
You
It's
know?
the best medicine, and you got to be able
It
to
is.
laugh at yourself.
Right. Don't take
Oh,
yourself too seriously.
Believe me.
It's true.
Nobody laughs harder at themselves than me every morning when I get out of the shower.
Yeah, it's a stressful
TMI,
time
Corey.
that you just gotta let it go.
It's the belly, Trisha. The belly is.
You're all plant based.
Yeah, but I'm still. Listen,
You're still 45, man. I understand. I get it. I get it.
I am eating all. I'm still all plant based.
Oh, that's good.
But I'm just eating a lot of plants right now.
Yeah. It's caloric. You got it.
Don't
What goes
need any
in
of
has to come out. It's the quarantine 15. It's no longer the freshman 15.
Oh, yeah.
It's the quarantine 15.
I lost 22 pounds, and I think it's all back.
Oh,
It's
listen, you got to get your little
tomorrow.
snacky snack.
beer is
Sometimes
plant
eat it.
based,
Cheers.
and you know.
All right. On a light fuzzy note, I don't want to. I'm one to delve right back into the serious stuff, but I'm not going.
No,
to
we
today.
have to end on a positive note. And,
We're going to end on a positive note. We'll have you guys back on. I want to wish you luck for this.
Can we have you back in like 3 weeks?
Of
Yeah.
course.
All right.
Oh,
Let's set that up.
will be. It's kind of neat as you come back. You're like, oh my gosh, that was so long ago, but it
Yeah.
was only 2 weeks ago.
We have an epidemiologist coming on the show who we had on the show before. It was one of our last non-physical distance shows. So we're going to have him back on, and we're going to be able to talk about stuff we talked about then, what came true. And
Yeah.
I love those types of progressions through this. So we have some openings at the end of June. You guys have to come on. I'll send you a thing to get on your calendar.
Yeah, if we're not in Aruba, we'll definitely be on the call.
I hope you're in Aruba. My mom
We can
has
do it
a
from
place.
Aruba.
My
If
mom
you're
has
in
a place
Aruba,
in Mexico.
I'm coming with you, and I'm dancing on the
Okay.
beach,
I'm there. We're there.
That's fine.
and I dance with this face.
Okay, that's right.
I'm really excited.
Well, I hope that everything goes the way of Caribbean paradise soon, especially for you guys who you need some space, you need some sleep. But first, the battle's not over. But we're all with you. We're here with you. And if you guys need to get a message out, if you want to blast out a new webpage or a new place for volunteers to sign up, let us know. We can add it on to any show.
Thank you so much.
Anything you need, we're call us. We're here. We've been trying to get you on forever, and I'm happy that you're here because
I just remember the last. There was just so much going on.
Oh,
And
right.
I to do
Listen.
with vaping and opiates.
I thought it was personal. So I'm glad
No.
you're here because now I know it's
They
not.
wouldn't say that to your face, Corey.
No.
They're going to get off the show and be like, oh, that was so embarrassing. He was totally right.
Yeah, you're
We are a
right.
very easy-going group. We deal with so many weird, odd things that we just go with the flow.
You gotta.
Yeah.
Have to.
You
And
gotta.
wash your hands.
Always
We do
wash
that
your
a
hands,
lot.
wear your mask,
Wash your hands.
Wear your mask.
disinfect, wash
Wear
your
your
cell
mask.
phone, clean it off,
Yep.
Oh crap! That's the one thing I forgot to do.
and your the wheel to your car, the driver's wheel. What is that called?
Steering wheel. And your
Steering wheel.
keys. Don't forget your keys.
Hey, where'd you go?
She's washing her phone right now.
Yeah.
Moved.
What did you?
I went to my
Phone's
car.
over it.
Listen, it was bad enough we couldn't remember NIOSH and CD this and XYZ
shut up.
that. But she's like, what do you call the thing that you put your hands on in your car when you're
It's
driving?
late. It's late.
Oh,
It's
man.
It's dark out.
Yes,
I
yes.
think.
Therefore,
Don't worry. I used to.
you're drinking the beer.
Every
The
time
last-
that phone slips.
The more
Oof.
important stuff comes in this side, the less important stuff goes out that side.
Okay. Yeah.
So now she knows all these contact tracing information. She can't remember the word steering wheel. It's how the
That's-
brain works.
That's right.
Maura's driving the ship.
Well, I thank you both for being on the show. And more than anything, I'm happy that our community members will now be able to get to meet you and get to see, I think, a side of your personalities that they probably don't often get to see.
I hope they don't throw tomatoes at you in the store.
Only
I
me.
hope they don't.
We throw back.
That's okay. We're pretty strong.
Yep.
I used to play soccer.
Get them. You get them.
You know, Trisha is a former rugby player, right?
Oh, Corey, you're always dropping them.
That's good.
See, nobody had anything to say about it. Nobody cared. Nobody
I
gave a
won't
shit.
I won't tackle anybody. There's physical distancing. They're safe.
I
I'll only give
wasn't,
them really
I was
nasty
expecting
looks.
like an oh wow or something, but nothing. You got
You
got
always
nothing.
mention it. Like, I don't know. It's
No,
all
that's
right.
I think the
Everybody-
first time I mentioned it.
Pretty darn cool.
I played soccer first in high school, and then soccer graduated to.
A rugby.
I'm a
Correct.
soccer
That's
mom.
good.
Okay,
I
so that
tried.
You played what?
I said I'm
She's a
a
soccer
soccer mom.
You're
My
a soccer
son
mom?
played soccer 4 years in high school.
Oh, okay. Is he still
I
in high
just-
school or no?
No, Evan graduated last year.
From Cheshire High?
Cheshire High.
Huh. I'll have to ask my daughter if she knows him. She's graduating this year, but
Oh, hard
yeah,
year to graduate.
yeah, I don't
We'll
want
see.
to.
We'll
I'm
see.
more
That's
upset about it than she
a
is.
whole other
Let's not
show.
go there.
Yeah,
That's my line. That's a whole other show.
that's a whole other show.
Yeah, yeah. No, I had last year's all night grad party, and all I can think of is those poor people that had started in August to plan that, and all the things that got canceled.
Oh,
Just it's
the
been
list is
it's endless, and it's
endless.
going endless. So
And 18-year-old kids, man, that's it.
Yeah.
That's what they had going on. It's
Well, what
Man.
about the dads who held their daughter on the day she was born and saw all
this
these
isn't about you,
milestones?
Corey. It's not
And now
about
the
you.
milestone that they saw is just
you create it in your front yard.
Yeah.
yeah.
If you have a parade, invite us.
Make
Okay.
your own memory. It doesn't have to be a high school, like at the school. Do something super cool.
Yeah,
The pressure's on, Corey. I've seen some
Thanks,
stuff
guys.
on Facebook.
I should have kept my mouth closed.
I've seen
Yeah,
some
let us
stuff
know.
that people
We'll
are doing
drive
on
by and
Facebook.
see.
Kate
All right.
always comes up with great ideas.
My husband's grandmother is turning 100 years old on Friday.
Oh, I bet she's thrilled to get the letter from. Never mind. Okay, so it's been a great show, everybody.
She'll burn it.
So
She'll
when
say,
is it
take
going
this,
to air?
man.
You're so
She
funny.
lives on her own, so we're trying to decide. We had a party planned. It's being canceled. Corey, you're not. This is not political. That's a whole other show.
No.
Remember?
The whole other show.
It's a whole other show. We try not to get too into too many controversial things because they will throw stuff at Corey.
Just
Yeah.
the thought of your grandmother getting that letter.
Oh, she picketed. She pickets. 100 years old. She pickets against the government.
Somebody
Oh, well.
call an ambulance. I'm gonna choke.
That's awesome.
Oh man.
She's probably waiting to get it to burn it.
Oh God.
She's
this is too
allowed. You can
funny.
do whatever you want when you're 100,
All right.
except for celebrate it with family.
Trisha, say goodbye. Say goodbye.
Thank you guys for coming on. You've been absolutely amazing.
You guys
I
are
hope
awesome.
to see you again. I'm sending you all the strength vibes that I can possibly muster and share to you guys. Know that the community is backing you, supporting you, appreciating you, and benefiting from everything you do every day. Thank you.
Thank you.
Thank you.
Yeah, you guys are my heroes today.
Be well. Stay healthy.
Okay.
All right, well-
Will, you too.
That was an episode, Trisha. That was fun. Hold on, Kate's adjusting her phone so she can log out.
That was
As
creepy.
we all go,
We're saying we gotta all say goodbye. So everybody, thanks for listening. This was the Cheshire Cast. That was Kate and Maura, and I'm Corey, and that's
Chesprocott
Trisha.
Health District on Cheshire Podcast.
So amen and goodbye and
Thank you.
see ya.
Stay healthy.
Always
Bye.
bet on black.